Okay, this video is called Why Did the Best Doctors Break the Rules? And this is about being able to judge clinical situations. A young doctor, they could be really smart, it doesn't matter, they don't have experience. So they have to follow the guidelines very closely because they're not sure what to do, and they know, again, you follow the guidelines, you can't get in trouble. Same thing with sort of an average or below average doctor. They know if they just stick by those guidelines, whatever they might be, match the old little pill and send a bill, they can't get in trouble no matter what happens to the patient. So they're probably going to stick by those guidelines. When you have somebody who's a better doctor, perhaps a little older, a little more experienced, they might question the guidelines sometimes. They might occasionally work around them, but they're uncertain quite often. Whereas a great doctor is somebody who's going to have a lot more experience, and they know quite well when the guidelines apply and when they don't. And they're much more confident in being able to know when to ignore the guidelines. They know, you might call them arrogant, but a lot of times these are their best doctors. And they know when the guidelines often don't apply, when they're stupid for certain situations. So I'm just going to give you 2 clinical scenarios to see how this works. Okay, situation number 1. Previously healthy, 20-something-year-old guy. He's a pilot. He got into a fight. He was knocked to the ground, and one of the witnesses at the time said that he had a seizure-like movement when he fell to the ground. He was sent to a hospital. The young neurologist did an EEG, electroencephalogram, on his brain and said that there was a possible seizure-like activity on the EEG. A lot of responsibility for a young neurologist trying to clear a pilot from a possible seizure, and the pilot was then grounded until further notice. The management decision made was an old expert neurologist was consulted. He looked at the EEG finding of the brain waves and said, you know what, this is just an artifact. And he's confident of it. The pilot was cleared, and that was 30 years ago. The pilot was fine. So the old expert neurologist, he had the guts and the experience to confidently say, this is just an artifact. We see this problem quite often incidentally. All right, here's the situation number 2. A 25-year-old guy, he fainted. He was sent to a young neurologist. He had a negative EKG. That's electrocardiogram. That's for the heart, because they thought maybe he had an arrhythmia, and the arrhythmia led to a seizure event, or not really a seizure so much, they call it a syncopal event, lack of blood supply to the brain because the heart stopped pumping for a moment, and perhaps that's what caused him to fall down. The neurologist diagnosed the guy with a seizure. Did he really have that? Maybe, maybe not. And when you got a hammer, everything looks like a nail. So a neurologist tends to call a syncopal episode more likely to call it a seizure. A cardiologist is more likely to call it an arrhythmia. But either way, the neurologist, put in the chart that this young guy had a seizure, and for that reason, he was not allowed to drive a car. And it's a problem for him because he doesn't have anybody to give him a ride and he can't work. So this has been going on about a year, and the young neurologist refuses to reconsider the diagnosis. Hasn't even done brain imaging, though, which is kind of surprising. So what do you do? And it seems like the best thing to do would be the same old story. Find an old expert neurologist, ask him to do the appropriate workup, get an EEG, whatever else is necessary, and see if, it's legitimate and it's the correct thing to do to clear the patient. But, waiting around is not going to change it. So I just say this thing, and the purpose of this is just to realize is doctors behave according to their context. It's not always going to be the same standard of care. That's what's usually going to be followed as a standard of care. But the best doctors are the ones who know when the standard of care doesn't really apply. So it's useful to know that, because it seems to me like the public tends to think all doctors are the same. And there's a tremendous variety amongst doctors, based on their age, their experience, their approach, their style, their knowledge, their confidence, their knowledge in other fields. You look at like a smart old doctor. Look at old McDougall, okay? He breaks conventional standard of care rules all the time because he's way smarter than the standard of care guidelines, okay? And I've also told you, I've read through all these textbooks, okay? The pathology textbook coming out of the Ivy League schools, the Harvard textbook. It's a joke. It's stupid. It's wrong in every major chapter. So there are times when the guidelines should be followed. They're very good, actually, for a lot of acute situations. But for a lot of chronic situations and unusual situations, they don't apply. So anyways.